We got a red dot. We're trying this take two. Welcome back to Akron and Northeast Ohio's hottest and fastest growing show, 3 to go. I'm your host, Hank. I'm coming to you live, and we're at Hudson. And again, we're in corporate, what's it called?
Hudson Corporate Park.
Hudson Corporate Park, all right? We're here at the, I got my cheat cards on this, say it all correctly. We're at the Stow Hudson Primary Care, which is part of the Pioneer Physicians Network. And we're here with Dr. Franciska Kiraly, okay, and Dr. Meghan Weiner. Boom. All right, got it. Let's walk around, make sure we're still alive. And we are. Ladies, how are you?
Good, yeah.
All right, so the first question I always ask is, people want to know who you guys are. So, Franciska, let's start with you. Tell us, what is your 330 story? Tell us about you.
So, I'll go back. My parents actually immigrated here from Hungary, like Eastern Europe. So they met at the Akron Hungarian American Club, and I actually grew up in Barberton, Ohio. Went to St. Augustine's in Barberton, ended up at Hoban for high school, Walsh University, North Canton, and then went to Wright State in Dayton for medical school. And then came back home, did my training and everything at SUMA, and then I did palliative care hospice. I felt like that was my calling, and then when I was in fellowship, I actually got breast cancer, so kind of shifted my life focus, and I ended up in primary care. So here for patients in all points of their life.
All right, and Megan, tell us about you real quick.
So I'm from Akron as well. I was born and raised over in West Akron. I went to St. Vincent, and then I went to St. Vincent St. Mary High School, so a little rivalry here. But and then I ended up going to Kent State for undergrad, and then right down the road at Northeast Ohio Medical University over in Rootstown for med school. Came back, did my training at SUMA as well, so really never left the area at all. And then I ended up, I'm actually still live over in West Akron, so still part of the whole Akron community, and now practicing up here.
Excellent. All right. So, boy, do we have a lot of commonalities, okay? So, first of all, I just posted today, I don't know if you saw it, but we're just coming to the realization that on Hoban, class of 92, we're realizing that we're all about to turn 50 this year. And it's like, so Hoban saved me. I love it. Does the rivalry ever become a part of things like the week of, like when the football games are going on or anything?
That
No,
hasn't yet.
not really. Yeah, I mean, I guess this was our first year together since I just started back in August here. But yeah, my mom went to Hoban, my dad went to St. V, and so it's just
That is funny.
the rivalry's always been there. But
All right, so tell us about the practice now. So how long, give us the history. How did this come to be? How long you guys been here and all that good stuff?
So after I left SUMA, I came up to the Stow Hudson area and took over for Dr. Maggio, who retired. So I kind of got his patient panel, and then I moved up here about a year later after that. So it's been a couple years that I've been up here, and then Megan joined me last fall. So.
All right, so, for those that are confused, let's talk about the idea and the concept of primary care physician. All right, so what is it that you guys provide in terms of services?
Sure. So we're both internal medicine physicians. We consider ourselves primary care doctors. So we do a lot of different things. We do all of your preventative screening, labs, your vaccines, all your preventative stuff like that. We help manage chronic disease conditions like high blood pressure, diabetes, high cholesterol. We'll do your annual physical exams, and then anytime you might have, you're feeling sick, something's going on, you come to us first. You got a common cold. It's nice to be able to have a primary care doctor to be able to visit even in those times of feeling sick rather than going to an urgent care or something like that. So we're here to be able to provide those different services.
Now, Megan, previously you had mentioned to me you guys are getting ready to start a program starting in March. So if you guys want to talk to me about that.
Sure. So what we've actually started here a couple of weeks ago for our patients and really anybody in the community, we've started a health and wellness program here on Tuesday afternoons. We've been over the past couple of weeks talking about nutrition. Yesterday we did a little focus group on how to read nutrition labels, and actually starting in April, actually the first week of April, we're going to be transforming that group into a walking group, and we've connected with Walk with the Doc. It's a national organization where you can get out with the doctor, walk in a specific area, you get different health tips of the day that you're walking with them. So we're starting a group here up in Hudson with that. It will be starting April 2nd, I believe, is that first Tuesday. It'll be at 5 o'clock. So we're still trying to figure out where exactly we're going to be doing it, but it's going to be at one of the local parks around here. It's open to anybody in the community. It's not just for our patients. Anybody. We want a lot of what we like to try to do, especially in primary care, is trying to help people with their lifestyle as well, getting healthier with their diet and exercise. So we've started this group to try to get people moving more and, bringing the community together to be able to do that.
Well, Francesca, you mentioned, thank you for sharing part of your personal story there, that you're a cancer survivor. Okay, so how do you work with that, and how do you incorporate that into the practice as well?
Well, I think I definitely, have seen the other side of medicine. So once I was in training and everything, you see it from the doctor side, but then when you see it from the patient side, you realize, getting responses quickly and just getting, testing done. And I think, as primary care, we're here for our patients, whether it's for their colds and sicknesses or whether down the road they have a lot of chronic conditions, they're seeing all these specialists and trying to help them manage to find a way to kind of live their best quality of life that they can. I just, day after day, I hear people say it's not easy to get old and, it's not for sissies. So we're here to help them. I think part of the wellness group is also going to be the mental, psychologic aspects. So managing stress, managing sleep, those parts of wellness as well.
Yeah, and it's, post, we always use the term post-COVID, right? Post-COVID, we're aware that mental health is such a huge issue right now in our country. And it's something that everybody deals with, and it's all dealt with at different levels, right? So, I think people get that general understanding as well, that the physical body is tied to the mental body as well. So yeah, that's great. So, all right, so let's take a look around. All right, we're in the place. All right, so let's show it off. All right.
This is the waiting room.
Okay. This I commented when I walked in that it was a very warm and welcoming waiting area. All right. So boom, there's the waiting area. We got the TV off right now, but there's a little TV there in the corner. All right. Boom. Somebody just said, "I love Dr. Kiraly." It is Kim, none your business. So whoever that is. So whoever Kim is loves you. All right, so here we go. And we walk on in this way. Okay, boom.
So this is kind of the main area where all the staff sit. So the nice thing about our office too is it's a small enough office, so when you're calling in, a lot of times the girls will know who's calling in, and then sometimes the patients will know who they're talking to as well. So it's nice, they already kind of know your story. You don't have to rehash it to some kind of big center where there's people on the phone.
When you have a physician over here, you'll talk to an actual person versus a machine, and that's kind of the nice thing. We're fully accessible. There's always somebody here. We're here Monday through Friday, 7 to 5. So anytime during the week that you're having an issue, you can call our office. And then we also have a call center afterwards. There's always a doctor on call in the after hours too. And then there's also an after hours clinic on the weekends, not here, but Pioneer offers a clinic. There's one in Cuyahoga Falls, in Akron, and in Green, Uniontown area, where on the weekends, instead of having to go to an urgent care, patients can actually go to the after hours clinic.
You can access your chart and everything and have all your information. Right?
So, and I'm going to use an old movie reference here. Okay, Doc Holliday. All right. So what a private practice does is it allows you to take the monster, massive medical animal that runs the whole planet in terms of care, and it takes it and it brings it down to that human and that interactive level where we get to know you and you get to know us. I mentioned to you guys, most of these family practices are very geographical, right? So you're only going to pull people from within a 5 to 10 mile radius typically, because people don't want to drive, all the way across town to go to a family practice. So with the one that we have, we're over in the West Akron area, near where you live, and that's the thing. Those doctors have gotten to know my family, right? And they've watched them all grow up. We've been with the same primary care physician now since my kid 1 was born, and she's 22. So you get those relationships, and that's really what you guys do, and you nurture that and you foster that, and we appreciate that.
And
so
I think that's really cool too. I was just saying to Zoe, my MA, that I have a new patient next week that's actually the wife of one of the patients I see right now. So you get these family members and everything, like you were saying, that come in, and
I feel like you get that whole story then, and then you see people and you know kind of everything that's going on with them that you might not get from a quick visit.
Want to show us the room here real quick on this way?
Yeah, right there's one of our exam rooms.
Typical standard exam room. Okay, we'll take a look. We got the bed over here, all the goodies. Okay, for all the checkups. Okay, is there anything that you guys do that's more specialistic than just doing normal exam stuff?
No, I mean we we've got the lab, we do blood work and things like that. Ultrasound actually comes here once, every other week, so we get to schedule our own ultrasounds here at the office, which is nice too. And we actually have gastro, one of the local gastro groups comes every other week. They're going to be coming weekly, so our patients at least get to kind of stay in the same office. They don't have to go somewhere else to get, see some of the docs.
And some of the different screenings, like I do some women's health screenings, like pap smears, stuff like that, and then I do a couple of different procedures, like if you have an abscess, I can help drain that. So a lot of just general primary care is what we do here. But like she said, it is really nice. We do have labs here, so you can, patients don't have to drive somewhere after their appointment to get their labs done.
All right, so, one of the questions people are always going to ask is what kind of insurance? You just accept all the standard insurance stuff?
Yeah, most of the insurances. Yeah. There's a couple we don't, but you can always just call the office and they can give you a rundown. But yeah, most of the Medicares, and we take Buckeye, United Healthcare, Medicaids as well, and then the commercials too. Okay.
All right, now give us the business details in terms of give us hours, when you guys are open, where can they find your information, all that good stuff.
So we're open Monday through Friday, 7 to 5. You can go on to pioneerphysicians.org or .com, and then you can find our location on there. Our phone number will be on there as well. And then we also have a Facebook group page as well, so Hudson Primary Care, for our health group that we've started, and then the Walk with the Doc will be posting more information about that people can follow as well to kind of keep up to date with that.
Well, that sounds great. Well, listen, I really appreciate you inviting me in today. Is there any other last words that you'd like to share with the audience?
No, I mean, we're just, like I said, I just started in August, so it's been a great transition being here. This is my first job out of residency, so it's been really good. I think even working in private practice like this, a really nice thing is that we're not owned by a hospital. We're 100% physician owned, so we're not having a specific place that patients have to go to get their tests and imaging done. We have, wherever their insurance covers, or if they prefer Summa versus Akron General, it's kind of up to the patient where they get all that other stuff done at, which is, I think, really nice. So overall, I mean, it's been a great time, but yeah, we welcome any new patients around here, wherever you might be. And then, like I said, with Walk with the Doc, that's open to everybody as well.
And I think the good thing, too, is with scheduling, too, we try to get our own patients in. We don't try to push them off. And then also new patients, we can do same-day new patient appointments. So if something comes up and people need to get in, they can just call.
Yeah.
Well, ladies, once again, thank you so much for having us. And we'll do our best to help to share that information as you have that health and wellness program coming up. And that's all I've got from here. All right, folks, thanks for tuning in. And again, we'll be sharing all their information in all the comment sections and sharing their upcoming programming as well. That's all I got. Take care, folks. Have a good night, everybody. And everybody out there, say good night, Shirley.